name is Suganya Sockalingam, and I'm here with my colleague, Annie VanDan, and we are part of the Pacific Southwest Mental Health Technology Transfer team. Annie and I will be co-presenting today. I will share a little bit more about the MHTTC, and then she will go over the agenda and objectives, and we will get going with the webinar. The content of this presentation does not necessarily reflect the views of the Center for Mental Health Services, Substance Abuse and Mental Health Services Administration, or the U.S. Department of Health and Human Services. So, what is the MHTTC? We are part of 10 regional centers, and our center is the Pacific Southwest Mental Health Technology Transfer Center. It's part of a new SAMHSA, the Substance Abuse Mental Health Services Administration's Technical Assistance Network. The Pacific Southwest serves Region 9, which is Arizona, California, Hawaii, Nevada, and the Pacific Islands of American Samoa, Guam, Marshall Islands, Federated States of Micronesia, Northern Mariana Islands, and Palau. The following is our role. We offer a collaborative model in which to provide training, technical assistance, and resources to support mental health workforce in Region 9 to adopt and effectively implement evidence-based practices across the mental health continuum of care. Our specific goal is to promote evidence-based, culturally appropriate mental health prevention, treatment, and recovery strategies so that providers and practitioners can start, strengthen, and sustain them effectively. As you can see, this is a broad gamut of services that we can offer. And as you learn more about us, you will be able to identify where we are able to support and serve you. Like I mentioned earlier, some of the services that we provide, and this is at no cost to you, is webinars such as these, and 2 more that we will provide through the end of May, a newsletter that I'm hoping that all of you have signed on to, and if you have not, maybe after this webinar you will do so, affinity learning groups around specific topics, individual coaching, individual consultation, which may arise out of your interest after this particular webinar. We also have tools, online courses, and regional trainings, which we can share more information via our newsletter and our website. So today, you will be hearing from me, and you'll be hearing from Annie VanDan. I am a knowledge transfer specialist with the Pacific Southwest MHTTC. I'm also a founder and a co-founder and a change specialist with Change Matrix. And I live in Nevada, so I am in Region 9, and it is really my honor to work in this region and support all of you. Annie?
Hi, everyone. My name is Annie VanDan, and I am based in Denver, Colorado. And at this time, we want to hear a little bit more from all of you. So we'd like to make time for some introductions. Thank you for sharing your organization and state and region, many of you. We're really excited about the turnout. It looks like there's 89 participants with us right now. We'd like you to tell us a little bit more about yourself. So what is your role at your organization? And then what questions do you have about cultural competence, diversity, inclusion, or other related topics for your organization? A moment here to let you think about some questions you might have. So while you're thinking about the questions and answering in the chat box, I'm going to move into the objectives and see if over the webinar time we're able to help answer some of your questions. And then also at the end, we have a specific time for Q&A. During our time together, we will talk about building culturally and linguistically competent organizations and providing effective behavioral health services in communities with diverse populations. Our objectives are to first recognize and explain the importance of culture and language in mental health services, explain cultural and linguistic competence, CLC. We'll be using that acronym throughout the webinar, and its use in meeting the needs of culturally diverse populations. Then we will identify ways we can lead and promote CLC in our service delivery. And lastly, we will explore ways to make the CLC change stick in your organization. So the agenda then will be to guide us through the objectives just outlined, And we will make this practical as well so that you are able to apply some of these ideas in your work. We'll start with definitions of what culture is and what cultural and linguistic competence is. Then we'll talk about what makes an organization or a system culturally and linguistically competent and how to get there. Next, we will share what the CLAS standards are, then move into ways to implement CLC and how leadership plays an essential role. And then we will have some time at the end for Q&A and to answer any of the questions you've typed in the chat box. So it takes more than training, policies, and words. It really takes leadership and commitment to make a shift to a new way of thinking and to operate as a culturally and linguistically competent organization. We titled this webinar, Delivering Mental Health Services Through a Cultural Lens, What Can We All Do? Because all individuals in an organization can influence cultural and linguistic competence, regardless of your role in the organization. So you can see we have such a diverse group of participants with us today. Some are clinicians and practitioners, some working directly with the community engagement coordinators, all the senior level and executive participants in the webinar as well. So we're going to talk about what is culture and then cultural and linguistic competence, and then what the challenge or problems are when we're addressing these two concepts. So here there are many definitions of what culture includes. I think often when we're asked what culture is, we immediately think of these concepts. So beliefs, perceptions, relationships, attitudes, practices, rituals, routines, and rules that inform our day-to-day interactions. This iceberg image has often been used as a metaphor for culture. So when you look at the iceberg, only 1/10 of it is above water. We can think of this as 1/10 of what we can consciously see about a person's identity. And just as the other 9/10 of the iceberg is below the water and is not visible, so is the other 9/10 of a person's cultural identity. So that 9/10 is out of our awareness. So like an iceberg, only a fraction of culture is visible. It's manifested through customs, language, and physical appearance. Actually, the majority of culture is hidden from view and expressed implicitly through deep-held values and preferences. So culture is broader than just what we can see. So you can use this iceberg metaphor as an activity when training people in your own organization. For example, you can pick a behavior such as how you greet people or facial expressions and talk in pairs about what this means in your culture. So whether it is you hug, shake hands, or make eye contact or not in your culture. Culture relates to much more than just ethnicity and race. You can see in this image, culture represents patterns of being for a group of people and how those patterns are expressed. It can refer to age, gender identity, spiritual, psychological, and social practice, or it can be a work ethic or an approach and belief system. When you take a look at these examples of culture, you can see the ones that are less visible or not visible at all. These are often the ones we don't talk about. Culture is the lens through which we see the world. It shapes our experiences, perceptions, and how we interact with each other. It's basically how groups of people believe, think, and act, how we seek care, and how we provide care. And of course, it does not mean that everyone in a particular group thinks or behaves exactly the same way. So we want to ask, what are some best practices for bringing out the out of awareness topics into conversation or working relationships? So some of those less visible concepts of culture, if you could share in the chat box any best practices for how we can learn these about the people we work with and the people we serve. So what role does culture play in behavioral health? Because culture is the lens through which we see the world, it affects the way we think about disease and wellness, and how we interact with people, and how we seek or provide health care. Another chat question is, what are some ways that you or your service population think about disease and wellness? One example is people in Cambodia, when they experience depression, there isn't a direct translation for the word. So in the Cambodian language, Khmer, what they say is Philia Duk Bit. I'm not saying that right, but it literally means the water in my heart has fallen. And that's the way they describe depression. Some of you may have also seen the recent movie The Farewell, about a Chinese family who do not want to tell their grandma that she is dying. It is common in Chinese culture to not tell an elder that he or she may have a life-threatening disease. So these are just some examples, and if you can think of any other cultural examples, to share those in the chat. Other things are just the mistrust of healthcare professionals and institutions outside of your own culture. Some people may feel that providers overprescribe or do not have their best interests, or they may avoid going to get care at all, especially their annual checkups, only going if it's absolutely necessary. This may be based off of some experiences of racism, discrimination, or bias, communication and linguistic barriers. If they don't have an interpreter or somebody who can help them speak during the appointments, they might just avoid making a doctor's appointment at all. This is also a lack of understanding of Western medical systems. This brings us to the definition of CLC. So cultural and linguistic competence is having the knowledge, skills, abilities, behaviors, and attitudes to be able to respond effectively to one another, not just in a way that we are comfortable or familiar with ourselves, but interacting within other people's context and culture is the foundation of the CLC. And CLC can lead to increased respect, creativity, and participation from diverse groups. So when we talk about cultural and linguistic competence, we'd like to encourage us all to think of CLC not as something that you have or don't have, but as a continuum or a journey. So in this image, you can see it starts with cultural awareness, a desire to engage in the process of becoming more knowledgeable and skilled, and then taking steps towards becoming more aware, such as doing individual and organizational self-assessment. And at this level, there's very little to no behavior change. As we learn and do more, we move on to cultural sensitivity, which is our knowledge. It involves learning about other cultures and perspectives and recognizing the value of interacting in a way that takes other people and cultures into consideration. The next phase we grow into is cultural competency, which moves from knowledge to having a skill. At this point, we start to develop the skills and the ability to use our knowledge and skills, and we practice that more intentionally. And lastly, that brings us to cultural humility, which isn't an end or an end goal, since it's a lifelong commitment. It's a lifelong commitment to learning, to continuing to meet each other where we are, and it's a continual process of evaluating where we are, how we are doing, what else we can do to learn and grow, and how we share power to create a mutual understanding and environment. There will always be new experiences, new people from different groups that we interact with, and always opportunity to learn. So take a moment to think about where you and your organization sit on this continuum, and remember that this is a journey. So why is CLC important? We know that racial and ethnic minorities tend to receive a lower quality of healthcare than non-minorities, even when we consider factors related to access, such as patient insurance and income, and then lower quality of care and access lead to poor health outcomes. So culturally and linguistically competent care at a systems level actually saves money, and it reduces health complications. In addition, CLC care can translate into positive health outcomes throughout the community, as well as staff who are happy, feel fulfilled, and stay in their job. And as mentioned earlier, it can lead to increased respect and participation from diverse groups. So next we'll have Suganya talk more about a framework for cultural competence.
Thank you, Annie. We've talked about culture, and we've talked about why culture is so important as we think about healthcare. And then, once we have an understanding of its value and importance, we now have to determine how do we then ensure that what we do in terms of providing care, in terms of providing access to services, in terms of providing the services themselves, and in ensuring the quality of services, that we use our cultural lens. And a framework for that is the framework of cultural competence. Now we can introduce this framework and a few practical ideas, which will allow us to take the theoretical concepts of understanding the value of culture and translate them into real life, both as individuals, and you all come to this work as individuals with very different roles, very diverse roles, and very different life experiences. And that of the organization where many of you come together to create that culture of the organization. And so one of the things we want to do is recognize that while cultural competence is important, it is only meaningful if we look at it as a lifelong commitment. So when organizations begin to embark on this journey, there is a variety of things that they will need to do, and they'll need to keep doing this and maintaining this. So for most of us who are in the healthcare arena, as individuals and as organizations, this is work of our life. This is something we're going to be doing for the rest of our work life. We need to recognize that cultural competence then is not necessarily an end goal, but a process. And it is an integral part of everything we think and we do, rather than just this separate theoretical concept that someone came up with. One of the things I want to do is then let's get us to all understand what this framework is about. So it is guided by several values and principles. It ensures that family is in the center of the system, of whatever system of care, of services and supports that we offer. That it is driven, this care, this practice is driven by the preferred choices of the individuals, the clients that come to us. And it is not something that is somehow culturally blind or culturally free in terms of how we provide services to people. The other principles that we need to think about is that we really need to understand there is both an individual basis to it and there is the complex system organizational process to it. And when we think of it as individuals who come to us for services, then we need to recognize that cultural preferences of this individual should support the determination of services that we provide. So that it determines their self-determination, determines how they access services and how they utilize services. It also means that we need to think about natural supports that people who come to us bring with them and the helping networks that are within their communities that we might want to partner with and collaborate with. It is also the recognition that once we do this, the knowledge we acquire needs to be put into practice and it needs to be put into policy. And this process of acquiring knowledge is going to be an ongoing one that will inform our practices and policies along the way. So these are the major principles that we need to pay attention to. Additionally, we also need to think about what are the components of cultural competence that we need to pay attention to. So there is both the organizational perspective and there is the individual perspective. What I'd like to do is start with the organizational perspective. And the elements that are critical is of one of valuing diversity, of doing cultural assessments at an organizational level, of managing the dynamics of differences. And your question will be, what is that? And I'm going to explore that with you. It's institutionalizing cultural knowledge. And in all the things we do, adapting the work we do to encompass the diversity of the clients we will serve. So valuing diversity. Take a minute and just think about your organization. How do you in your organization value diversity? And if your organization has done a good job of it, share with us some ideas of what they do. One of the things a community healthcare organization in New York City did is they recognized that they were in an area where there was a lot of Asian Pacific communities. And yet what they noticed is that people weren't coming into their clinics in the numbers or in the ratios that they were anticipating. So they really had a conversation about this and they decided to bring in some community experts. And one of the first things the community expert is saying, there is no feng shui in this space, this space in which people come in and sit down and wait for services. And the concept of feng shui is of balance, of invitation, of honoring and respecting the cultural need of the community. And so what they did is they redid the waiting room and added this huge aquarium with beautiful fish floating. And if you know that water in many cultures is one that is powerful that is calming and has a lot of spiritual relevance. And so in that way, they were valuing the diversity of the clients that would be coming into their clinics. Cultural self-assessment is something that many organizations have focused on. The National Center for Cultural Competence that resides at Georgetown University has developed many self-assessment tools, both at the organizational level, at a provider level, at a clinician's level, and these are all available. So if any of you are thinking about doing an organizational self-assessment, that might be something that you would want to pay attention to. So what is managing the dynamics of difference? A lot of organizations will say we need to diversify, and they will do a really good job at recruiting and bringing on board a diverse group of people. What they have not prepared for is that this diverse group of people come in with very different worldviews and very different ways of thinking, and therefore they need to think about what will happen in that organizational context. It opens up room for conflict, for stress, for disagreements, and because this diverse perspectives and worldviews has not been taken into account. So, managing the dynamics of difference is an organization that proactively thinks about it, ensures that the organization pays attention to it, and manages that the human resources in the organization is prepared to address this. Institutionalization of cultural knowledge. There have been organizations in the early days when they said, oh, you know what, we have this huge influx of Hispanic clients. So let's make sure that in our front area, intake person is someone who is Hispanic and can speak the language. And then if anything happens in terms of providing services to the Hispanic clients or Latino clients, they all go to the frontline desk person and say, hey, how do I do this? How do I do that? Which happens in organization, and it has happened in organizations. One, the frontline person isn't prepared for this. This is not something that they intuitively, from a cultural sense, understand about health beliefs and practices of everyone in their community. It is also, they don't have the training and the qualifications to do so. And at the same time, when they leave, that knowledge base leaves with them. And so, this notion of institutionalizing cultural knowledge is to ensure that everybody in the organization recognize the need to know certain things and to be prepared to provide services in meaningful way. And another thing that the organization that adapts to diversity does is it ensures that this is integrated into their policies, integrated into their structures. It informs their values that everybody knows about, and it informs the way services are provided. So this is at the organization level. At the individual level, each and every one of us has the capacity to become culturally responsive, to be aware, and to be competent in how we can communicate and work with other people. And that begins with our own awareness and acceptance of differences. First, we need to know our own cultural values and who we are as cultural beings. And then we learn about the values that different cultures hold on certain issues. We raise our awareness and we accept that those differences are natural and normal. We understand that when we work with someone who comes from a different background, a different cultural context, there may be opportunities for having differences in the way we think and in the way we do our work, and that we are then open to learning and working through those differences. We recognize the need for cultural knowledge, and whenever possible, we acquire knowledge. That isn't to say that we're going to know everything there is to know about every culture that comes through our door. That is not what we mean by cultural knowledge. But there are ways of being, there are ways of thinking, there are ways of doing that can go across any culture. And it's knowing those things that become really important. It is essentially the ability to adapt our practices to the different cultural contexts of the individuals and the families that come to us for services. So these elements that we need to incorporate into our practice, both at the individual level and at the organization level. But we also need to recognize that all those elements that we've talked about, whether they are for us as individual providers or for us as organization, has to happen at all levels. It has to be at the policy making level, which means that our C-suite officers all need to be aware of it. They need to do their own work of becoming cultural beings who understand their own culture and recognize how culture informs how the organization provide services. It needs to occur at the administrative level where the infrastructure is determined. Our practice manuals, our policy manuals all have to incorporate these concepts. It has to be in the way we deliver our services. How do we deliver services that are culturally relevant and culturally responsive? How do we integrate, like we had talked about earlier, natural networks of support from the community? So when a client comes in, do we allow the client's family or a cultural broker from that family to be a part of the conversation, recognizing that the confidentiality issues are in place, and yet finding ways in which we can integrate both those needs, that of confidentiality and that of the need of the consumer, the need of the family. So it needs to be reflected in our attitudes, in our structures, and as I've said before, in our policies and services as well. This is a really integral way of looking at it. We also need to look at the fact that organizations have resources that they get from primary care healthcare centers, get their resources from the federal government. And the Department of Health and Human Services, the Office of Minority Health, recognizing the need for people to be able to take all the theoretical discussions we've had and really put it into a practical process. They develop what is called the CLAS standards, the culturally and linguistically appropriate CLAS standards that are relevant and available to all of us. These were published in 2000, and then it has been enhanced in 2013. And it is guided by the Civil Rights Act, the American with Disabilities Act, and the Affordable Care Act. So being culturally and linguistically competent is not just a nice thing to do, it is guided by these legislations that govern healthcare in this country. Why do we use the CLAS standards? We've talked about the importance of ensuring the quality of services and ensuring that we get the outcomes we want. We also need to recognize that we are a rapidly changing country and our demographics is constantly evolving. So we need to become more culturally responsible to meet the needs of the diverse communities that exist in the United States. It is also important for us to use CLAS standards so that we can eliminate disparities. And we also, as I mentioned, we also need to meet legislative mandates. And for some private entities, it also helps them in the competitive marketplace and it helps them to minimize liability claims. So there is value in providing culturally and linguistically appropriate and competent services. So one of the things that these 15 standards do is they have one principle that has this overarching concept of providing appropriate services, but they also have specific standards on governance, leadership, and workforce issues. And then they have standards on communication and language assistance, and also on engagement, continuous improvement, and accountability of services. So these are all within the CLAS standards, and it serves as a useful tool. So, one of the things that we want to think about is implementing cultural competence in services and support systems. And Annie is going to share a little bit of her thoughts with you on this topic.
As we move into implementation, the Pacific Southwest MHTTC, we've developed a guide for implementing cultural competence. And since this is an introductory webinar, if you are interested in taking the next step to implement strategies, we do welcome you to contact us. Our information will be shared at the end of the webinar. For Region 9, we can offer a limited number of free one-on-one consultations, regional trainings for organizations and communities of practices to support your implementation strategies. If you look under the session handout, there's a PDF with a link to a form. And we will also be sending this link out after the webinar to find out more about your interests. So this is an opportunity to tell us what some of your needs may be. And if you aren't in Region 9, you may also contact your region's MHTTC for technical assistance support. Before we talk more about implementation, it's helpful to know what you are striving to achieve. And here's a visual that helps you see what CLC looks like when it permeates at all levels. So Suganya had talked about the individual versus the organization, but this moves into community and the broader systems level. These are some different examples. So having a culturally competent staff, culturally responsive organizational policies, and community engagement, and always looking at data for ongoing improvement. And Suganya talked a little bit about what the CLAS standards are. The practical goal areas, at the end of this webinar, we will share with you this guide. It was developed by our center with strategies on how to implement cultural competence in these goal areas. It includes a package of resources for planning, implementing, and evaluating the integration of cultural and linguistic competencies into mental health service delivery. So how does a CLC approach show up in services and support? These are a few ways that you can see or experience the benefits and outcomes of a culturally and linguistically competent organizational approach. Suganya gave the example about the feng shui. Do you have decoration in your office or center that's welcoming to the people that you serve? Are your hours responsive to the needs of the community? And do you provide resources in appropriate languages and at appropriate reading levels? Maybe some other ideas. I see some people sharing providing support to individuals that are HIV and AIDS positive. Yes, like tailoring the work and the resources towards the community served. If there are any other ideas that you can think of, please also share those in the chat. The different approaches that your organization is currently doing already, or ideas you have that you would like your organization to start doing. So this slide talks about or shows the implementation of CLC. It's the framework that we often use. So it goes beyond the definitions and continuums and standards. What does that all mean in practice? How do you become a CLC organization and implement culturally and linguistically competent care? So as you can see here, it's not a straight line. Small measurable steps are the key to success in this ongoing systems change process, which is reflected in this circular visual. Implementing CLC requires all the elements in the framework. The first is an assessment of an organizational and community level, and then planning with various stakeholders, including recipients of service. The third step is capacity development to meet the needs of the population, then implementation, and then lastly, evaluation. Hopefully this sounds a little bit familiar from earlier when we were talking about the continuum, moving from awareness to sensitivity, skills and competency, and then humility. This is one way of looking at those steps, and then go over how we can do that. So the first step is doing cultural self-assessment, and then collecting demographic data, and then doing additional needs assessments. So I'm going to go over these fairly quickly because, again, we would like to offer one-on-one consultation if you're interested, and the regional training. So the next step is to use the data to plan strategically in order to implement the CLC approach. And at this point, you would develop a written plan with clear goals, policies, and plans. Developed with input from the staff at all levels, and then also input from the community, and then being sure to get commitment from leadership. The capacity building, you would want to recruit diverse staff and leadership that represent the community and redesign jobs, the roles and functions of those jobs, and then provide ongoing professional development. So here are some examples of innovative ideas your organization could do to build capacity would be to bring a cultural artifact to lunch, invite local cultural leaders to share their story, hold a book or movie club, and then rename roles. So for example, the director of First Impressions. If you have any other examples as well of what your organization can do to build capacity, please share those as well. And then implementation, implement CLC mental health services, ensure services are accessible, doing ongoing monitoring and adjusting as needed, and then making sure community and client needs are being met. The evaluation component, again, is just to have the ongoing monitoring, using data to get an accurate picture of the community, evaluate the implementation of your plan, measure satisfaction of participants and of staff, and then to monitor and evaluate the cost. Keep in mind, because of this circular element of the framework, you're often kind of jumping around to different steps, and it really is an ongoing process. So one of the things we touched on was the importance of engaging leadership and having leaders on board to move the organization to a CL approach. And then Suganya now is going to talk about how to lead the way for CLC.
Thank you, Annie. Asking an individual or asking of an organization to become culturally responsive, culturally humble, culturally competent requires shifts in values, it requires shifts in beliefs, it requires shifts in practices. And these are very hard things to shift. And because of that, one of the ways in which the integration of cultural competence can occur within an organization or within an individual is by really understanding how to do this work. And so the work of integrating cultural and linguistic competence in organizations requires a different kind of leadership. And one of the things that we often do in the work we do is we talk about this concept of adaptive leadership. And it's a concept and a framework and an understanding that really resonates with me because in the 20 odd years or so of me doing this work, I have recognized that when we don't shift our values, when our values remain the same, when we have certain beliefs and we use those beliefs in which to create or plan or assess, then we are continuing to do the things that we've always done. We're not making the shifts that we need to become culturally competent. So, one of the reasons why I like adaptive leadership is that in adaptive leadership, there is a recognition that the deeply held beliefs that we have to challenge them. We have to challenge them individually. We have to challenge them within the organizations. We also need to recognize that things that we thought were valuable, things about ourselves as leaders, that we are directive, that we know how to motivate and convince people of how to do things. Those are things that we've always held to be important values. We now will begin to recognize in this adaptive leadership that requires all of us to come together and collaborate will be less useful values. And we'd have to let go of these values and to take on other new values. We also will come to recognize that the skills that we used to have, maybe we were really very good at getting everybody to buy into what we think is important because we're really good salespeople. That may no longer be an important skill in this leadership journey of being an adaptive leader. And so we may have to sort of let go of that skills. And so one of the things that we recognize is it takes a different kind of leadership, but it's a leadership in which all of us can participate. There isn't just a leader in an organization. If the organization is willing to be open and to shift its way of thinking and understanding, it can bring people together to develop collaborative partnerships where those diverse perspectives come together to actually identify the problems because some of these problems are very difficult and very complex, and then to identify the solutions together and find meaningful strategies that can be put into play. So, one of the things we need to think about is how do we lead this work? One of the things we need to do is make a commitment very clear and very visible. We need to be opening to collaborate, and particularly in this work, collaborate with our communities and our diverse stakeholders who live and work in our communities. We need to share the work and share the power. Yes, there will be a sense of loss sometimes when we no longer are the one who are leading every effort. But in letting go of that power, we will get so much more. It is important to communicate clearly and frequently. It is important for us to be sensitive of the very diverse perspective and therefore the very differences that exist. and giving it time to change. We can't put a practice that is culturally competent into place today and assume that it's going to be immediately absorbed and immediately practiced right away. So we need to be planning for that. And most importantly, each and every one of us need to be committed, truly committed to wanting to provide culturally responsive, culturally humble, culturally competent care. And so that's the leadership that it's going to take. So we want to open this up now in the next 2 or 3 minutes. If anyone has a question that they would like to voice at this point, we're willing to take it. Rochelle, I know, has been trying to respond to your questions in the chat feature. She might have gotten to all of them, but she might not have gotten to yours maybe. And if you want to make sure that that gets addressed, please let us know and ask your question.
So it looks like we've had almost 10 different questions. So we're going to put together a handout of all the questions from the webinar and provide that after with responses and answers to all of those questions. Suganya said if there are any now, feel free to go ahead and type in your question. But we just want to be thorough in the process.
There's one from Kimberly. How can an organization offer a welcoming environment to those who have a very different lens than that which is being promoted within the organization? Welcoming, tolerance, boundaries. So that's your question. So what the question is, how do we sort of bring resonance to different opinions in terms that exist between the organization and the clients that are coming in, and yet create an environment that is welcoming? I think one of the things that we need to openly articulate is we need to articulate as an organization our vision, our mission, and what we stand for. We also, in that vision and mission that needs to be so available to the community that all know about it, we need to articulate that we recognize there are differences and we honor and respect those differences. And so a client who's coming in that might have a very different perspective will feel like even if they feel differently about something, they're able to come into this organization because the organization has been very open about this and has made their vision of respecting and honoring differences as a key aspect of who they are. And so that might be one way in helping to welcome people. I have to admit that the word tolerance does sort of rub me the wrong way. I've often tried to understand why. To me, a tolerance is really not acceptance. And to me, someone who tolerates me doesn't really value who I am, I think. And therefore, I'm more likely to look at the word acceptance than the word tolerance, although I know that oftentimes organizations do talk about that. And also the recognition that the organization has a certain culture and values a certain culture. It doesn't have to give up that culture in any essence to welcome a variety of diverse cultures into the organization. So, in terms of having boundaries, I think the boundaries is recognizing that there is a diversity of culture and we appreciate all cultures and we honor all cultures, that we are not going to sort of overlook or over sort of negate the different cultures that exist. Rochelle, you have a question from Mark and about government that requires services be adapted to be culturally competent, yet other arms of the federal requirement. Yes. This notion of evidence-based practices, I think you're bringing up the notion that if we want to only use evidence-based practices, then it's a challenge because so often those practices have not been normed or validated for our communities. But increasingly, you will find, and you'll find it even within, like in SAMHSA, the Substance Abuse and Mental Health Services Administration, they talk about this concept of community defined practices, meaning that they're open to this notion that communities come with practices that have historically worked for them and that they are open to looking at those practices. So you're beginning to find that there is an openness to looking at practices that are beyond evidence based. So I'm going to turn this back to Annie because she has a few more things she wants to say.
So thank you so much for joining us today. We do have some upcoming webinars about workforce diversity strategies and then implicit bias, how it affects the work that we do. Please join us and register for those. And then this slide shows our contact information. Do email us if you have any additional questions or follow-up. And again, we will be sending out a follow-up to all the questions from the webinar, along with a link to the interest form. Here is the link to the Pacific Southwest MHTTC newsletter as well. This training was supported by the Pacific Southwest Mental Health Technology Transfer Center, funded by the Substance Abuse and Mental Health Services Administration, to support resource development and dissemination, training and technical assistance, and workforce development for the mental health field. The ability to continue offering no-cost training and technical assistance through the Pacific Southwest MHTTC depends on the completed feedback form from participants. The form we are required to use by our funder is quick and it's easy to complete. It's critically important to us to have your feedback. Completing the form means we can continue to provide offerings to you and your colleagues at no cost. It only takes a few minutes, and by completing the form, you are ensuring that we are able to continue to provide these services. So thank you again for joining us today.